Hey everyone, welcome back. You ready to dive into something different today?
I am. Always up for a challenge. What are we digging into?
We're tackling health data, and I know what you might be thinking.
Not exactly as exciting as, say, searching for lost cities, right?
Exactly, but trust me on this. It's way more important than it might sound at first.
I'm intrigued. I've been curious about this whole health data world myself.
Yeah, and a lot of you have been asking for a deep dive on this, so buckle up. We're going to break it all down.
All right, let's do it. Where do we even start with something this big?
Well, first things first, we got to talk about what kind of data treasure we're dealing with here.
Right, because it's more than just your steps and heart rate these days, isn't it?
Way more. We've got articles here about how this whole thing could actually make you some money. Future of health data monetization. That's a mouthful.
Future of health data monetization, yeah, that one's a doozy. But there's important stuff in there.
And then there's research on how people feel about their data being used.
Yeah.
There's something dot PDF, the usual light reading.
Oh, absolutely. Gotta love a good research paper. Always a page turner.
But for serious, we've also got this report on how people are actually trying to put a price on data. Value of data report, very official sounding.
Sounds like we've got our work cut out for us. Lots to unpack.
We do. And the thing that really surprised me, there are already places where this data is being bought and sold.
Really? No way. I had no idea it'd gotten that far.
Yeah, it's kind of mind-blowing and a little unnerving if you think about it.
I can see why. It does make you wonder, where do we fit into all of this?
Right. It's our information, after all.
Exactly. So before we even get into the buying and selling of it all, we've got to lay down the basics. What kind of data are we talking about here?
Yeah, like what exactly is out there and who's collecting it all?
Right. I mean, think about it. You've got your fitness tracker, your sleep app, your smart scale. It's like we're surrounded by these little data generators. This Future of Health data monetization report really gets into just how much data is out there.
It's true. And everyone seems to want a piece of the pie. Tech companies, researchers, hospitals. But what are they doing with it all? That's what I want to know.
The million-dollar question, right? And more importantly, like you said, where do we, the ones generating this data, fit into the picture?
Exactly. It's our information, after all. But right now, it seems like everyone else is calling the shots.
It's true. A lot of this data gets us is for research, for developing new products, improving healthcare systems, which are all good things, of course.
Definitely important stuff.
But I see what you're saying. There's this imbalance. We're handing over all this incredibly personal information without always knowing exactly how it's being used or if we're seeing any direct benefit from it.
It's like we're baking a cake.
Right.
Providing all the ingredients, but only getting a tiny sliver of the final product.
Yeah.
And maybe not even the flavor we would have chosen.
And someone else is out there selling the whole cake and making a profit. I like that analogy.
That's where this whole healthy coin thing comes in, right? It aims to change that dynamic a bit and put the power back into the hands of, well, us.
Interesting. So Healthycoin is trying to give us, the individuals, more control, maybe even some rewards for our health data. We're going to get into that.
We are. Because instead of just being the bakers in the background, Healthycoin wants to make us the owners of the bakery. Or at least give us a say in what happens to all those delicious data cakes.
Yeah.
So how does this Healthycoin thing actually work? Is it like I download an app and I start earning points for every mile I run?
It's a little more sophisticated than that, though. The earning rewards for healthy activities is part of it.
Okay, so walk me through it. I'm picturing something like my online banking app, but for all my health stuff.
That's actually a pretty good comparison. It's like a central hub where you can pull in data from all your different devices and apps. Your fitness tracker, your sleep app, maybe even that meditation app you've been meaning to try.
So it's all in one place. Convenient.
Right. But convenience isn't the only goal here. One of the most interesting things about Healthycoin is their focus on giving you, the user, real control over your data.
That's good. Right. I mean, if I'm going to be putting all my health info in one place, I want to know it's secure and that I'm the one calling the shots.
Absolutely. And that's where their consent and privacy management tools come in.
Okay, so let's sign on the dotted line and more, let me customize exactly what I'm comfortable sharing.
Exactly. It's all about transparency and choice. You decide what data you share, with whom, and for what purpose. Let's say there's some research being done on a health condition you've experienced.
I can choose to share my data for that specific study if I wanted to.
Exactly. You'd be contributing to something that could potentially help a lot of people. But on the flip side, let's say you're not comfortable sharing your, say, sleep data.
Yeah, some things feel a little too personal,
I hear you. And that's totally fine. You keep that private. With Healthycoin, you're in control. You're not handing over the keys to the kingdom. You're choosing what doors to unlock.
I like that. So no more all-or-nothing data dumps?
Yeah.
But how does it actually work on the back end? Like,
Oh.
how can I be sure my data is really secure and that my choices are being respected?
That's where the whole blockchain thing comes in.
Okay, whenever I hear blockchain, I kind of tune out. It's one of those things that sounds way too complicated.
I get it, but it's actually a pretty simple concept at its core. Think of blockchain like a digital ledger, but instead of being stored in one place, it's distributed across a network of computers.
So, like, if someone tried to tamper with the information in one spot, everyone else would know.
Exactly. It makes the whole system incredibly secure and transparent. So any data you choose to share through Healthycoin, it's all tracked and verified on the blockchain.
Okay, starting to make a little more sense now, but let's get to the good part, the coin part. How do I actually earn rewards through all of this? I mean, I'm already giving them my data.
Well, first off, you're not just giving them your data, you're choosing to share it on your terms.
Yeah.
And in return for your contribution, you can earn healthy coins in a few different ways.
Okay, lay it on me.
One way, as we've touched on, is by sharing your anonymized data with researchers or companies developing new products and services.
Okay, so they get valuable insights, and I get rewarded for participating.
You got it. But it's not all about data sharing. Remember those health challenges we talked about earlier?
The step counting competitions and such.
Yeah.
I love a good competition, especially if I'm being rewarded for it.
Well, Healthycoin lets you earn rewards for hitting those goals, too.
So it's like gamifying our health goals and potentially getting something tangible back for it. I like it.
It's a win-win. But, even with all these potential benefits, we can't forget about the concerns people have about data privacy in general.
Right, because all this talk about data sharing and rewards,
Yeah.
it's going to make some people nervous, and rightfully so.
Absolutely. We can't just gloss over those concerns. That's why I found that research paper on fitness trackers so interesting, the one with the long title.
The something.pdf.
Yeah.
It really highlighted how important transparency and user control are in all of this.
Right. It's not enough to just have a privacy policy buried somewhere in the fine print. People want to understand how their data is being used, and they want to be able to easily adjust their settings.
It's like you were saying earlier, choice and transparency are key.
Exactly. And what's interesting is that the researchers actually found that most people are willing to share their data if they trust the company or organization asking for it.
It's all about trust, isn't it?
Exactly. But trust has to be earned. You can't just demand it.
And that kind of takes us back to Healthycoin. They seem to be putting a lot of emphasis on those key principles: transparency, user control, and building trust.
They are, which is encouraging. But it's still early days, right? The real test will be how these platforms evolve and adapt as more people become aware of the value of their health data.
The brave new world out there in the health data landscape, that's for sure. But speaking of value, how do we even begin to put a price tag on something as personal as our health data? It's a tough one, right?
Mm-hmm.
How do you even begin to put a price on something so personal?
It really is a complex issue. We've got these reports, the value of data report, and that other one, what is the value of data?
Yeah, those ones, they both dig into this whole question of data valuation.
And it's not as simple as just slapping a price tag on it. This report actually emphasizes that there's no one universally agreed upon method for valuing data.
So it's not like, I don't know, selling your old bike online. It's more complicated than that.
Way more complicated. This report outlines 5 different approaches to valuing data.
5. Okay, so there are options at least.
There are. And they each have their own strengths and weaknesses. Some focus on the cost of actually generating the data.
Like the equipment and the time it takes to collect it all.
Exactly. Others look at the potential economic impact of using that data, like could it lead to new products, new industries?
It's all about the possibilities.
Right. But the approach that really resonated with me, especially given what we've been discussing, it's called the impact-based approach.
Okay, tell me more about that one.
So instead of trying to put a direct dollar value on the data itself, it looks at the real-world impact that data has had.
So it's about telling the story of how that data has been used to make a difference.
Exactly. It's about showcasing the value, not just talking about it in abstract terms.
I like that. So what kind of impact are we talking about here? Give me some examples.
Sure. The report talks about how open government data, information that's freely available to the public.
Right.
Well, that kind of data has been used to fuel innovation and actually boost economic growth in certain sectors.
Wow, that's huge. So we're talking about real, measurable impacts on people's lives.
Absolutely. And when you think about health data specifically, the possibilities are even more incredible. Imagine a world where researchers have access to this huge pool of anonymized health information.
It could be revolutionary, right? Like leading to faster drug development, finding cures for diseases.
Exactly. Your data, shared with your consent, could be a part of something so much bigger than yourself. That's powerful.
It is powerful. It's like you said at the beginning, health data has gone from this abstract idea to something that has the potential to truly change the world.
And you, the individual, are at the center of it all.
So as we wrap up our deep dive today, here's something I want everyone listening to think about. What if your healthy choices, the data you generate every single day, could contribute to a healthier future for everyone? That's the potential power we're talking about here. It's up to all of us to learn about this new world of health data, to engage with it thoughtfully, and to make sure it's being used for good.